I'm Casey Vallance from Cox Rayner Architects in Australia. The project that we presented was the University of Queensland Oral Health Centre in Brisbane. We were told early on when we were working with the professors of dentistry from the university that there's a very high anxiety associated with the profession because of the pure technical aspect of those facilities, and could we actually look at ways to reduce that? We really wanted to change the experience of arriving to a healthcare facility. The placement of the building was very important. While it adjoins a hospital, we've also placed it directly in a park environment. And so we positioned the entrances into the clinics and reception areas directly off that park. We actually looked at the park and the natural environment and thought, well, how can we incorporate materials from that landscape? And so the use of timber species found within the park, the use of stone, so that the movement for all users from the park through the threshold of the external environment created a far more relaxed environment. Moving into the receptions, we really wanted to change the scale from a very large open plan environment to a far more intimate, personal space. And we really looked at that as a living room. Really both creates a calming environment for the patients as they arrive, which as direct response then helps the teaching environment to be far more efficient and responsive to the patients. The teaching spaces are obviously the fundamental aspect of a teaching facility. Typically, you'll have 30 to 40 chairs within one space. And so could we change that into essentially a scale that a private clinic would have, a one-on-one experience, a single chair within a room, but then still needing to understand that it's a teaching facility, so clear observation and safety need to be considered. So the use of glass, transparency, but in a far more relaxed environment.